Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Well, we all know the pain and pressure associated with a sinus infection. But in today's Neighborhood Health Watch, we want to talk more about when sinus infections get serious enough to need medical attention. Dr. Daniel Van Himbergen from Henrico Doctors Hospital is here to talk more to us about the warning signs of chronic sinusitis and treatment options. Thanks so much for joining us.
Thank you for having me.
This is the time of the year when this really flares up. So talk a little bit more about what is chronic sinusitis.
Well, chronic sinusitis is a disease process of inflammation in the sinus passages, and it usually is present for 3 months, and the constellation of symptoms that people have are commonly congestion, thick postnasal drainage, sometimes decreased smell, and facial pressure.
Right.
And if that's present for 3 months or more and failing current medical regimens such as nasal steroids, sinus rinses, and antibiotics, then it can be a problem that really bothers a lot of people.
Does it typically affect a certain person?
Usually it's more common in adults, and teenagers,
okay.
but children can get it as well. But adults, it usually affects their quality of life more often, causes them to miss work and just and impact their life in a more significant way.
We'll talk more about treatment options, specifically balloon sinuplasty.
Okay. Well, medical management involves longer courses of antibiotics, nasal steroids, prednisone, saline rinses. But when that fails, patients are looking for other more permanent treatment options. And balloon sinuplasty, that is an in-office procedure that can be done under local anesthesia with minimal recovery, very low pain, and people can usually return to work in 2 days. It involves a balloon catheter, kind of like an angioplasty for the heart, that goes into the sinus, dilates it, and is removed, and this restores normal sinus function.
Oh, wow. And the recovery time?
Usually just a day or two, people are back to work.
Okay, I like that. How can we find out more information about this?
You can look at our website, www.virginiaent.com. Has a lot of indication and links. There's videos of procedure, animations, and just further details about what you can do to see if you're a candidate for something like that.
And are you seeing a lot more of this, especially this season?
Oh yeah, this time of year, because a lot of times colds kind of bring the sinus problems on, and the way the weather's been, you know, this is the time of year.
So you said if it lasts more than 3 months.
That's for chronic, but if you have more than 4 acute sinus infections, which is just the normal sinus infection responds to antibiotics quickly, if that happens 4 more times a year, that you're also a candidate for further options like sinuplasty.
All right, very good information. Thanks so much for joining us.